to recovery is a straight line, but when you're ready, it leads you to Sierra Tucson, treating mind, body, and spirit with the most advanced clinical and integrative therapies, led by a world-class team of doctors and therapists who have made Sierra Tucson the leader in addiction and behavioral health treatment for 30 years. Step out of your routine, focus on recovery, and miracles can happen. Sierra Tucson, where change begins.
That's right. Sierra Tucson is not only a leader in everything that has to do with addiction therapy and disorders, but it's also a place that combines a wide variety of therapies to heal on every level.
And Dr. Donnie Sansom, Associate Medical Director and Director of Addictions at Sierra Tucson, is here to share more with us. Pleasure to have you here, Doctor.
Thank you. Thanks for having me. Appreciate it.
So September is National Recovery Month, and we're talking about the importance of integrative care when it comes to treating these disorders. Why is that so critical for Sierra Tucson?
It's a great question. Well, at Sierra Tucson, we have an approach that we see people as a whole. We treat the mind, body, and spirit. So when we talk about integrative medicine, it's kind of a buzzword, and it can mean a lot of different things. It's often been associated with things like complementary alternative medicine, such as naturopathic physicians and mindfulness-based practices, yoga, shiatsu, and other massages, acupuncture, all kinds of things that we know have a great healing power to them, and we certainly embrace all of that. But we also appreciate what SAMHSA, as the Substance Abuse and Mental Health Services Administration, speaks of in terms of treating patients as affecting their physical needs combined integratively with their mental health needs, and we think that's very important.
Right, because when they go home, they're having to take care of both.
Right.
So rather than just treat it with professionals there on one aspect of it, to treat both just helps them even more, go back to their normal routines in their lives. And families are such a big part of this too. You said it was like a spectator sport for people who are in the family watching this happen.
Right. So most patients, by the time they come to see us, there's usually a history, and there's often family association in terms of involvement with, maybe they have an issue with addiction or with a co-occurring disorder such as anxiety, depression, codependency themselves. And our family week allows the families time to come together, to learn, to heal, and to relate to each other in a protected and guarded way with our therapists. And it's really a touchstone for further healing in the family. And without that support structure being available to them when they go home, it's very difficult. So we find that to be vital to our experience.
Well, it takes a village, right? I mean, to raise somebody up and help them out and help them heal and help cure them. And so let's talk about areas of treatment specifically and the different types of treatment that you treat patients with.
Great, thank you. Yeah, great question. So at Sierra Tucson, our roots have been as an addiction treatment center, and I think a lot of people around the Tucson area know us that way. The truth is, Sierra Tucson has literally an international footprint, and we see people from all over the world, and we treat their ailments with mood, such as anxiety, depression, codependency issues, bipolar disorder issues. We treat chronic pain issues. We have a phenomenal comprehensive chronic pain program. We treat trauma, which we find is antecedent to so many of these things. And of course, how does all this integrate in with their addiction? We also treat secondary eating disorders. So there's a lot of things that we address, and we feel we need to address to actually treat our patients as mind, body, and spirit.
It can be debilitating. I mean, when you're talking about anxiety, I think more and more that is in the news because people who are on a greater scale, whether they're sports stars or whether they're they're singing stars, whatever, they're starting to come out and say, "Oh my gosh, I couldn't get on the stage, or I couldn't go back out onto the basketball court because it was so debilitating." And now it's more of a conversation. Are you seeing that?
Absolutely. One of the things is to not hide in the shame and to not hide in the darkness about these things. Anxiety indeed is debilitating, as is depression. We know that nationally issues such as suicidality are on the rise, and they're directly tied into anxiety and depression, as well as the opioid crisis.
Right.
And let's not forget, alcohol still kills more people than opioids in this country each year. So all of that plays together. If you're self-medicating your anxiety and depression with a substance, or maybe you're just not being properly treated, it's difficult to heal.
Yeah. Doctor, thank you so much for being
Thank
here.
you. I appreciate it.
Of course.
It's important. The Sierra Tucson team will give a complete financial outlook before your visit, and they work with most insurance companies. If you'd like to learn more and find out where they are, you can call them right now at 1-800-842-4487.